afternoon, everybody. I am Dr. Biswajit Banerjee, practicing in Kolkata, and I am practicing diabetology for the last 30 years. Our today's discussion will be understanding hypertension. We'll generally talk about what is hypertension, what is the goal, what are the complications if you do not treat hypertension properly, and how to control your blood pressure. Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the walls of blood vessel. This is called blood pressure. Normally, in a healthy individual, it rises and falls throughout the day. But when blood pressure remains high for a longer time and left untreated, it can lead to serious consequences and complications. In general, persistent increase in blood pressure higher than normal blood pressure is known as hypertension or high blood pressure. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices. For example, not having enough regular physical activity, obesity, smoking, alcohol consumption, and stress, etc. There are other risk factors that can also increase the risk of developing hypertension, such as age. As people get older, chances of getting hypertensive increases gradually. Family history of high blood pressure. If you have got a family history of high blood pressure, you are more prone to develop hypertension. Excess salt intake is also known to raise blood pressure. Not eating enough foods with potassium can increase blood pressure and the risk of stroke and chronic kidney disease. Eating processed and fatty foods can cause hypertension. On the other hand, lack of physical activity is also linked to obesity and further to high blood pressure. Another one is stress. Reacting to stress in unhealthy ways or not managing stress can also increase blood pressure. Moving on, hypertension doesn't have any obvious signs and symptoms. For that reason, it is called silent killer. It puts people at risk for several diseases, from cardiovascular problems to kidney failure, stroke, and even eye damage and blindness. Hence, early and accurate diagnosis of hypertension is very important, and management of hypertension is more important than not only diagnosis. And fortunately, the diagnosis of hypertension is very easy because it can be diagnosed simply by measuring your blood pressure. It is usually measured with an instrument called sphygmomanometer. A blood pressure is recorded in two numbers, systolic and diastolic. Now, you may wonder what is systolic and what is diastolic. Let's try and understand what do these numbers actually mean. A healthy or normal blood pressure should be lower than 120 by 80 millimeter of mercury, or it can also read as 120 over 80 millimeter of mercury. Here, the upper number indicates systolic blood pressure, which means pressure in the blood vessels when the heart contracts, whereas the lower number indicates diastolic blood pressure, means the pressure in the blood vessels when heart relaxes and it takes rest between beats. If blood pressure level is or more than 140 by 90 millimeter of mercury, then the person have hypertension. If person have BP goals higher than this, then he or she might at risk of developing serious heart problems. On May 17th, we celebrate World Hypertension Day, a day dedicated to highlighting the importance of monitoring blood pressure and bringing global awareness to the 1 billion people living with high blood pressure worldwide. The theme of this year's World Hypertension Day is measure your blood pressure, control it, live longer. Ensure that your BP is measured and controlled if it is elevated. The risk can be prevented and reduced by taking steps towards a healthier lifestyle so that you do not develop hypertension. What are those steps? Like regular exercise, healthy diet, regular blood pressure monitoring, stress management, and adherence to medicine. If blood pressure is successfully controlled with such lifestyle modification, you may not need a medicine to control your blood pressure. Now, talking about regular physical activity or exercise, exercise can be a drug-free approach to lowering high blood pressure. Regular physical exercise makes person's heart stronger. If one have a strong and healthy heart, it can pump blood more effectively and efficaciously with less effort, so that pressure doesn't increase. In other case, as we are all are aware that age and weight gain are the two major risk factors for high blood pressure. So if the blood pressure is at desirable level, that is less than 120 by 80 millimeter of mercury, then exercise can help prevent it from rising as you age. Number two, healthy diet. Diet also plays important role in controlling blood pressure. A diet with a high intake of vegetables, fruits, and whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through dietary intervention, one can adopt dietary patterns. There are various dietary patterns such as DASH diet or Mediterranean diet, eating less saturated fat and total fat, getting plenty of potassium, limiting the amount of sodium in the diet, and avoiding alcohol consumption. DASH stands from dietary approaches to stop hypertension diet. Eating a DASH diet that is rich in whole grains, fruits, vegetables, and low-fat dairy products and skims on saturated fat and cholesterol can lower one's blood pressure by up to 11 millimeter of mercury if having high blood pressure. If you can reduce sodium in your diet, even a small reduction in the sodium in the diet can improve the heart health and reduce blood pressure by about 5 to 6 millimeter of high mercury. So what are the steps to decrease sodium in your diet? You can consider tips like read food labels, eat fewer processed foods, because most of the processed foods are high on salt and sodium. Don't add salt. Do not add extra salt in your diet. Stopping smoking helps your blood pressure return to normal. Quitting smoking can effectively reduce your risk of heart disease and improve your overall health. Then comes the importance of regular blood pressure monitoring. Some of the hypertensive patients check their blood pressure by visiting doctors, but it is not always possible for patients to visit doctors and check up their blood pressure. Hence, most often I advise patients self-monitoring of their BP levels. Not only self-monitoring, a new concept is coming up recently, ABPM, that is ambulatory blood pressure monitoring. When you are in your office or home. Self-monitoring helps person to measure BP at different times throughout the day and over a longer period of time. It also assists doctor to get a more complete picture of person's blood pressure readings at different times so that we can control your blood pressure more effectively. There is one entity that is called white coat hypertension. Many times patients get anxious or stressed when they visit the doctor's chamber and we record high blood pressure. But he says, doctor, I don't have such a high blood pressure at my home when I measure by home BP machine. So home blood pressure monitoring is very, very important. What about stress management? By learning how to relax and manage stress can improve emotional and physical health and lower high blood pressure. Stress management techniques include exercising, listening to music, yoga, focusing on something calm or peaceful, and meditation. Adherence to medicine is very, very important. A medicine to lower blood pressure may be recommended by doctor. If your blood pressure is consistently high, usually at or above 140 by 90, adherence to medicine is very important, as it controls your blood pressure regularly. If you stop your medicine abruptly, that may cause rebound hypertension. The pressure may abruptly rise and cause devastation like stroke or heart attack. At last, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adopting healthy lifestyle can help us to enjoy a long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications. It is very much possible to maintain normal blood pressure levels with regular monitoring of blood pressure, and preventing care. Thank you very much. Stay happy, stay healthy.